Welcome to Chamber Exchange, the TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce. And Chamber Exchange, the TV show, is an opportunity for us to talk about issues of economic development, have conversation with Chamber members and others who are working every day to strengthen the economy of Central Massachusetts. And speaking of that, we want to thank our sponsors who help make the show happen. That's Bank Hometown and St. Vincent Hospital. And pleased to have with us in our first segment, Donna Bartlett, who is a board-certified geriatric pharmacist, also a professor at the Mass College of Pharmacy, MCPHS University, yes, as it is now known as. So Donna, maybe you could just talk a little bit about what is a certified geriatric pharmacist, and then maybe we can talk a little bit about your book.
Yeah, that's wonderful. So a board-certified geriatric pharmacist is someone who specializes in geriatrics. I've taken a board exam in order to specialize, so beyond my regular training in pharmacy, I later went on to specialize into geriatrics. So I've been a pharmacist for over 30 years, and as you know, geriatrics take up a big population, and it's a growing population.
So I've got a birthday coming up. When does somebody become geriatric?
Sure. So it depends. Sometimes some medical literature says 60. Others say 65 and older. Okay. But somewhere in between that 60 and 65 is when people are considered to be in their geriatric years. Now, we're all living longer, too. So we have young geriatrics, our 65-year-olds, and then we have our older geriatrics, and those are, more 85 and older.
Right, and the baby boom generation,
yes,
being as large as it is, a lot of people kind of in that spectrum.
Yes.
And certainly, a factor, and one of the reasons that you just mentioned people living longer is, the incredible strides that have been made in healthcare, but also in the life sciences, pharmaceutical industry, yes, with a lot of pharmaceuticals that are able to cures or therapies or treat various conditions. And that's in many ways a good thing, but sometimes too much of a medication is a bad thing, or if somebody's on different medications, there's ramifications that people may not know about, even people in the healthcare space. And so you try to sort all that out, I guess.
I do. So I like people to think about how long they've been taking medications for. We're really good at adding on more medications because we want to help people, right? So a lot of prescribers will add on medications, especially if someone isn't feeling well. So someone starts off with a couple of medications and years go by, and now more and more medications are being added on. When our bodies change, and when our bodies change, the way medications work also change. So we might have more side effects to a medication, and someone's thinking it's a new problem. So now they're treating this new problem when it really could be the medication. And then as people age, more and more medications are added on, unfortunately, and all of a sudden somebody is now in the hospital with 15 or 20 medications, and how did this even happen? So we really like to look at the number of medications people are taking, and do they need them all? Your body has changed. Lifestyle changes too. Some people get healthier as they age. They have more time to exercise and eat well and cook. So so maybe they've made some of those lifestyle changes too and don't need as many medications.
And it's probably important for people to think about that. I mean, we know, generally speaking, our healthcare system is stressed for a lot of reasons. One of those is the shortage of, primary care physicians, and their ability to kind of maybe take that time with the patient is not maybe what it once was. Their ability to kind of be aware prior to, the different medications somebody are on, the latest trends of some medications can cancel out other medications. So
for sure.
The best thing is for people to kind of become their own advocates or educate themselves a little bit on this?
Absolutely. So I think an important factor is many people think that because they've gone through their medicines at the doctor's office, there's been a review done. And that's just a medication reconciliation. It just means, do what we have on record, does it match what you take at home? And it's not a medication review. Medication reviews are much more extensive. They look at drug-drug interactions, drug-disease interactions, how the person is doing. We really like to think about people, what matters most to them, how is their mind, either mood-wise or cognitively speaking, what medications are they taking, what's their movement like, and are they able to do what they want to do in a day. And when we start feeling tired or weak or over-medicated, unsteady, things such as that, then people aren't moving as much. They're not able to stay as well as long, and they end up falling, which is a problem. And then there's cognitive decline. Sometimes just removing some medications that aren't necessary anymore or causing more side effects as we age, that can help somebody tremendously so that they feel better. Someone on 20 or even over 5 medications is considered polypharmacy. 10 medications is hyperpolypharmacy.
Wow.
So once we get to those numbers, once we get to those numbers, we start having to say, wait, we've got to see what you really need. What's really important for you? Is everything appropriate right now? It might be, but in another couple of years, it might not be. So we want to be proactive and make certain that you stay healthy and in your home.
Right. And so towards that end, you've written a book
Yes.
and a workbook. It's titled Med Strong, Shed Your Meds for a Better, Healthier You. And it talks about a 5-step plan. So maybe you can kind of give us the cliff notes, and then that'll hopefully entice people to read it, and we'll talk about where they can hopefully get the book and the workbook.
So the book and the workbook. In the workbook goes through a 5-step medication optimization plan. And the first thing that we want people to do is look at their meds, look at their med list. How long have you been taking something for? Do you still have that issue? Because sometimes we don't have the same issues. And or is it helping? Sometimes people say, I don't even know if this is working for me. So that's the first step. The second step is once you start going through that process, you can start making questions. And so you have better questions to go ask your prescribers and your providers and say, I don't even know why I'm taking this medicine, or I've been taking it for so long. Do I still really need it? Those are great questions to start asking. And then you have a discussion. You have a discussion with your provider and you decide, can you stop something or reduce something or switch something to a safer alternative? Because all of those things are active plans in order to make certain that the meds you're taking is safer. And then you come up with a plan. And you're not going to stop everything all at once. It's a process. You didn't end up on 10 medications all of a sudden. It was years probably to get to that. So we have to look at things slowly and take them off slowly and monitor and follow up and document, and that's the last step. So it's just like prescribing, where you start something new, you have to go for blood work, you have to go for a follow-up. When we're reducing meds, it's the same thing. You still have to go for maybe the blood work, maybe some office visits.
So the book outlines the 5-step process and the workbook.
And the workbook takes that 5-step process and really blows it up. It asks a lot more questions. It really allows people to write things down. It truly is a workbook to work with your providers and to see, do I need this med? Does this make sense? How can I maybe reduce or stop this medication? If I do, there's a de-prescription in there. So instead of a prescription as to how to take, how are we going to stop something, and what do we need to do for that monitoring and follow-up?
And consistent with your role as a professor at CPHS University, also educating people about how and why they're taking various things and understanding if it's still needed, and then being their own best advocate.
Yes, 100%. So I've done outreach for Mass College of Pharmacy. That's how I started off there, other than being a student at Mass College of Pharmacy in Boston. But as in my pharmacy career, I was in their outreach program, and I traveled all throughout the state, going to many different senior centers and hearing the stories and looking at brown bags of medications and overflowing pill boxes. And it really stuck with me that, wow, this is just too much. There's actually international conferences on deprescribing. It's not just a U.S. issue. It is a worldwide issue. I was just in Montreal recently for their 3rd conference on deprescribing. And so it's a concern everywhere. It's just not here. So I think people have to know they're not alone, but where there are people out there that do want to help and reduce unnecessary meds.
And certainly as people get older, oftentimes family members are involved with care and an opportunity for them to understand as well. If someone, our viewers are interested in getting the book, learning more, where can they go, Donna?
Yeah, so it is available on Amazon. Both of them are, but also people can see me, more information in my books at wellhoodconsulting.com. wellhoodconsulting.com. Well, great. Donna Bartlett, professor at MCPHS University,
board-certified geriatric pharmacist and author.
Yes.
Educator and advocate. Great being with you.
Thank you.
Okay.
You too.
Okay.
Thank you so much for
Stay
having
with us.
me.
We're going to come back on our next segment.
These days, you've got your hands full in life. That's why we help you bank simply and securely with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.
Worcester, a city with heart, history, and promise. A hub of innovation in life sciences, education, and healthcare. Home to multi-generational families, first-generation citizens, and next-generation baseball and hockey greats. Home to great parks, world-class museums, theaters, and restaurants. Worcester, the place to visit, to invest, and to call home.